Exchanges need to be up and running by the beginning of 2014. So the planning really has to begin now.
There's a range of goals that a state might consider in terms of its exchange. That's probably one of the most vital first questions to ask with all of the stakeholders involved so that you know what it is you're building.
The biggest misconception about the exchange is what it really is. Some people seem to consider it as its own risk pool. Really, the exchange is just a marketplace. It's a place where insurance is sold.
There are things that the exchange does that benefit the marketplace generally, and then things that the exchange does that benefit the individuals and the small employers who are served by the exchange. So there's going to be a portion of these costs that are going to be borne either by state government, the insurance marketplace as a whole, or the individuals and small employers who purchase via the exchange, because those costs will probably be passed through from the health plans to the exchanges. So everything has to be value added. In my mind, that's a good thing because it means you really have to be very focused on what your goals are.
The thing that is probably one of the more difficult things to deal with is having a marketplace that brings together both the public programs as well as the private insurance market and figuring out how the two are supposed to work together.
The biggest challenge for the state is, in setting up the exchange, having the systems for the exchange be able to talk to the systems for the Medicaid agency, because individuals who are no longer eligible for Medicaid have to be able to move seamlessly into the exchange system.
Even though the administration is signaling that states will have more flexibility going forward, the first pass is going to be a federal pass. And then the states will get to tailor the exchanges to align with state health policy and what the market conditions are there locally and what the politics are like there locally.
Exchanges will have a significant influence on the design of health insurance products. The diversity of products in the exchange and out of the exchange will be a function of what the state does to design the exchange and constraints they put on the non-exchange market.
You could also expect to see people who are currently purchasing in the individual market outside of the exchange to migrate into the exchange if they want to take advantage of the tax credits and subsidies that are available in the exchange. So that alone, I think, is going to be a significant change in the competitive landscape.
Not only will insurance companies have to provide quality, adequate network of providers, but they have to ensure that that network of providers includes providers for certain populations. Things to ensure that the healthcare system is accessible to everyone.
Every state will have unique challenges or characteristics of their market that will make setting up the exchange different. For example, in our work for the state of North Carolina, the local Blue Cross plan dominates the market, covering about 2/3 of the people. That presents unique challenges when you combine the risk characteristics of that existing market to those of the new exchange enrollees.
I think every state's going to come at it a little bit differently, just based on their current perspectives and their current populations. It's going to depend on how large a state is. A solution for Texas won't be the same as a solution for Rhode Island.
As each state is setting up their exchange, they will look to the states that have done this before, Massachusetts, Utah. But ultimately, healthcare is a local business, so each state will adapt that to suit their own circumstances.
One of the critical factors is making sure that you're balancing your internal expertise with external expertise and people that have and organizations that have a broader focus and can look across the landscape. That's really useful because it can both help you assure that you're focused on the right issue and also give you a perspective about things that you might not see directly yourself on how the landscape is changing. And so, for example, we actually are consulting with Milliman on the impact of health reform on our lines of business.
Exchanges are new for just about every state, so this is all new stuff for everyone. Actuaries are uniquely qualified to help do some of the projections associated with implementation and long-term ongoing costs associated with an exchange because of our work for carriers and other state programs where we're having to do similar types of projections.
I've worked for many years with insurance carriers, helping them provide insurance to their members, and this healthcare reform is very exciting, and I'm thrilled to be able to bring that experience into the exchanges and into the new world of healthcare reform going forward.